Today, I'm Dr. Malik. Today we'll deal about headaches. We know that headache is one of the commonest thing, and I have mentioned about different types of headaches. All these headaches I have mentioned in detail in my recent lessons. But the thing is, we will put them together and what sort of care you should take, I'll just tell them. First, number one, most common cause is tension headache. Most common cause is tension headache. Tension is not for you and me. It is for the muscle. It is for the muscle which is there on the head, called occipitofrontalis. It starts from here and ends here. It completely covers the head. Once this muscle goes into stress or tension, it catches, the headache comes, and it is something like a gripping pain, and it is more common when you are working, when you are continuously working, you don't have sleep, and you have not taken enough food, you are hungry, you have not taken enough water, you are dehydrated. These things are very common, and particularly in school children and college going boys or girls, if they are complaining of headache daily in the evening after coming from college, one thing is very important. They may be having some ophthalmic problem. They may be having some error in the eyes, some visual error in the eyes. Let them close one eye and see like this. If they are able to see equally, if they are not able to see this, though you should go to ophthalmologist. You should go to ophthalmologist. This tension headache, if it is coming to young individuals, like school children and boys or girls or college going, you must see the ophthalmologist and correct the eye problem, visual error. You may need some glasses or whatever it is. So number one. So what are the medicines you must keep at home? Dolo 650, that is paracetamol. Paracetamol with caffeine. These are, if you get relief with this, it's okay. The paracetamol with caffeine, we used to get a tablet called Crocin pain relief, long tablet. You can take it, very good tablet. Paracetamol with caffeine. Aceclo-MR is one tablet. Suppose you don't get relief with these two. Aceclo-MR is a muscle relaxant. So that the muscle relaxes. If you don't get relief from this, simplest medicine is this, and second best medicine is this. Last, if necessary, only you must take this tablet. And if there is any vomiting sensation, tension headache will not have any vomitings. So if there is any vomiting, you can take Domstol or Andem tablet for any type of vomitings. And then second type of headache is migraine. Migraine, everybody knows. Usually it comes one side of the headache. Migraine comes only one side of the head. It is not both the sides, and you have aura, something like. Before you get migraine, the patients themselves, they say that, yes, I am likely to get a headache. I have some strange features, like I am seeing flashes of light, something like that. So this is called aura. So most of the migraine patients, they know that they are getting headache. They will have this aura before. Migraine is associated with vomiting and nausea, heavy vomiting and nausea. Usually migraine patients cannot, it's only one-sided. They cannot tolerate lights, they cannot tolerate sounds. They go into a dark room and sleep. So before that, they can take Dolo 650, that is paracetamol with caffeine, and Aceclo-MR also. These three things. See, if you see, Aceclo-MR is one more tablet which can give relief. It's a muscle relaxant. Domstol, Andem, I said, if vomiting sensation, migraine, there will be vomiting sensation. And tablet Sumatriptan, this is a specific tablet. Tablet Sumatriptan, 50 mg to 100 mg. One tablet, single dose, can be taken, but it is usually with doctor's permission. Okay, Sumatriptan is a specific tablet which should be taken after doctors, and you can go to the doctor and decide. But this is one type of, that. Next comes sinusitis. Everybody knows what side of sinusitis is usually preceded by some allergy, some nasal discharge, some nose irritation, nasal discharge, some small discharge from the nose. Usually what is sinusitis, I explained in previous subject. Same sinuses are there behind this bone, and maxillary sinus behind the maxilla. So these are air cells which open into the nose. So the drainage will be clear in the beginning. Maybe it is caused by some infection or allergy, and next it becomes thick pus yellowish or greenish. So these things are important. So it continues 3 days, 4 days, like that. Yeah, for this case you need antibiotics. For this case, you need antibiotics. And to prevent allergy, you can use it. Suppose you are having allergy frequently, you can use Deonase nasal spray. Deonase nasal spray to prevent allergy. Morning once, evening once, just spray into the nose. Once in the morning, once in the night, to prevent allergy. You can continuously just keep it at home. While going out, you should spray into the nose. While after coming back at sleep, you should spray once again. This will prevent your nasal allergy, so that you can prevent sinusitis. Next, coming problem. Otrivin nasal drops or nasal spray to prevent, once sinusitis and you have blocked nose, you can use Otrivin nasal spray or Otrivin nasal drops to immediately just get relief immediately from this nasal blockade. This is temporary, but this one is for prevention of allergy. And you can take all these tablets, like any one of these tablets, Dolo, paracetamol with caffeine, aciclovir, Domstol on them. Usually sinusitis doesn't have vomitings and nausea. No, it doesn't have. So here it stops. Okay, so sinusitis also needs antibiotics. In 3 to 4 days, you may need antibiotics, and you may need some X-ray, CT scan, etc. like that. Usually, X-ray will be enough. But if you are continuously getting it, I have clearly made a topic on sinusitis. Please try to go through that. Surgery. What is the surgery done? I have clearly mentioned. Next comes cluster headache. What is this cluster headache? I told you it comes in clusters, and it is not common. It is not at all common, very rare. Only that too followed by some alcohol or something like that. Only one particular eye, right side or left side, is involved. Severe pain, 15 minutes to 3 hours. Only it will stay, but that is a horrible thing. You have to get admitted in the hospital for those 3 hours and all. There is very good prevention also. You can prevent it also. Please try to go through. It is only one-sided. One eye is involved with this part, and eye becomes red, nasal discharge, every horrible thing will happen. Try to see that topic, but it is not common. Okay. Next comes trigeminal neuralgia. Trigeminal neuralgia, in fact, it is not a headache. It comes to the face. It is a face shock in the face. Shock. It comes like a shock, paroxysmal shock to the face. Eye is not involved, only this part, maxilla and mandible, 2 branches of trigeminal nerve, they are involved, and it is like they can't even move. It comes only for few seconds to 1 minute, and the patient becomes frozen like this because he can't move the face. Only one-sided. You can take any one of these tablets, and particularly tablet sumatriptan, which is given for migraine, is also very, very, very useful in trigeminal neuralgia. It is 50 to 100 milligram single tablet. But one thing is, trigeminal neuralgia, it is not temporary. It comes frequently. In paroxysmal attacks. Attack comes, goes. It's like a shock. So it's severe, unbearable. You have to take treatment for it. I already made a topic on it. Please try to see that. Next and last is meningitis and tumors. These are danger headaches. See, what happens is, it doesn't stay for 1-2 days. No, it is not 1-2 days. Weeks or months. Okay. Suppose meningitis, the patient is already having some fever for 3 to 4 days. Then he cannot move the head becomes stiff. He will have continuous vomitings with severe headache. That means the patient's these bacteria or viruses which are in the body, which are causing fever, have entered the brain also. That means it is not brain's coverings in the brain. The coverings in the brain are affected. The coverings of the brain are affected. They are called meninges. They get inflamed. That's why he has vomitings, headache, raised intracranial tension. So this needs very, very important attention, very dangerous, and patient can go into convulsions also, fits also. Headache, vomitings followed by fits. So this needs urgent treatment. one has to get admitted in the hospital. If the patient is running with temperature, severe headache, continuous vomitings, don't neglect, please. This is meningitis. Tumors, any cerebral tumors inside the brain, if there are any, see, usually this meningitis, it is bilateral, both the sides. And tumors, both the sides. It is total head. Any space occupying lesion, any tumor is there in the brain, then the patient will have continuous vomiting, severe headache. The scene is not, you cannot mimic the scene, it is horrible. The patient will be very, very dull, headache, vomitings, etc., etc. You need to go to the neurophysician, take a CT scan or MRI, and most, to our luck, most of the brain tumors, they are benign. See, 70 to 80%, they are just benign tumors. So that means they are not cancers. Only 30% or 20% are cancers. That is the luck you have. So you have very good surgeries for it. Please don't neglect. These are things to be